to our Mommy's Love video. And today I'm doing this video because it's the topic that we're going to talk about is IV fluids, okay, and how IV fluids affect breastfeeding and basically your labor and delivery. And I definitely can relate to this because I encountered this, and it was really the beginning of all my breastfeeding challenges with my first son, Samuel. And what happens is we don't really think too much about it because IV fluids is something that is routine. And just to kind of tell you what IV fluids means, intravenous, which basically means it's like a direct way to get hydration and medicine directly through your veins, okay? And it's pretty much an old age practice that has been done for labor and delivery since like forever. And it's a standard practice in most hospitals as well. But like I said, IV fluids are not necessary for you to have a safe and natural delivery of your baby. You don't really need them at all. In fact, the World Health Organization is starting to recommend against using IV fluids during labor and delivery. That is in the case that you're going to have like a normal or routine labor and delivery. There's really no need to have them. It's actually more problems that it can cause, and I'll go into those so that you understand all your options and you educate yourself a little bit more in regards to how they affect labor and delivery, so that you just don't turn up at the hospital and then you're immediately given them without knowing how they affect you, okay? And like I said, and I always say this, hospitals have their standards and their routines, and the reason why IV fluids are so important and part of their standards is because it's kind of like an extra safety measure that they take. Because in the case that you did have to have like an emergency C-section or complications arose during the labor and delivery, then they have you with IV fluids already, so they don't have to worry about that, and they can administer drugs or medicine directly into your veins. So that's why they do that, but they've been overly precautious because most labors don't result in emergency C-sections and things like that, so you don't really need it. So I'll go into why they've been using it and what happens. Okay, so basically IV fluids, what they do is they prevent dehydration and they allow for the administration of pain medication. So in the case that you were gonna have like an induction or a C-section, or you knew that there may be complications during your labor and delivery, then yes, it is a good idea to have IV fluids, but that's not the case for most women, okay? So that's who kind of I'm reaching out to, the women that are gonna have or have had a normal pregnancy and you're expected to have a normal labor and delivery, okay? And the reasons why, okay, these are like the bad points of IV fluids. What it can cause is that it can cause excess newborn weight. So your body will retain a lot of these IV fluids, especially if you've had a long labor, okay? And your baby will retain that also. And what can happen with that is that, first of all, you will have very kind of swelled breasts, and you'll probably have experience some pain from that too, which will make it very difficult for your baby to latch onto your breast, which will make it very difficult to breastfeed. And in turn, what will happen is you might end up having to supplement with formula, and then that can cause you some anxiety because maybe that wasn't part of your plans or what you were expecting. That's exactly the sequence of events that happened with my story. And the other thing too that can happen is when you're on IV fluids as well, your energy levels actually get depleted. It's actually a lot better to have energy source from water and food than to have it from IV fluids. And if you see that this happens, you know, if you're in labor for a long time, especially when you have something like an induction, your labor is really, really long. So you're hooked up onto those IV fluids for a really long time. I was hooked onto the IV fluids when I had my induction for about 14 hours. From the moment I got to the hospital to the moment that I delivered my baby. So that's a long time to be having those IV fluids and no food and no water as well. The other thing too is you're restricted. You're hooked onto the IV fluids, so you can't really walk around, which again, that makes your labor longer. If you're active during your labor, it actually speeds up your labor. So there's no need to be on those IV fluids. So it's a lot better to the alternatives that you have. For example, it's a lot better to go on like what we call a clear liquid diet, which is that you're just having very, very light liquids, very light food during your labor and delivery, and then that way you can stay hydrated as well, okay? And the other thing that I wanted to comment, just so that you understand why hospitals do these type of things. So the other thing too is if you were going to have an emergency C-section or something like that, Hospitals don't like to have food or water or anything like that. They just want you to be on the IV fluids, because there was evidence from way back in the day of aspiration to the lungs from the fluids, which caused deaths basically during C-sections. But there's very little evidence that that was a direct cause, and a lot of associations, like I said, the World Health Organization is recommending against the IV fluids during labor and delivery. So there's no really not much connection there, or for it to be a concern to you. Okay. The other thing, which I explained earlier about the newborn weight loss, because your baby is taking in those IV fluids too, essentially, so they're going to have a larger weight after they're born than realistically it is. So what happens with that is, let's say for example your baby is going to weigh 8 pounds when they're born. That's because they have a lot of water retention. So what happens is, usually all newborns have a little bit of weight loss after they're born. Usually it's about 7%, which is normal and there's nothing to be concerned about. But with babies that have had their moms on IV fluids, we see a huge drop in their weight loss in those first like 48, 72 hours. It can be 10% or more. And when that happens and you're in the hospital, it basically rings alarm bells for the hospitals and the nurses. So they're like, oh, your baby's losing too much weight. The breast milk is not coming in fast enough, so we're going to have to give your baby formula. So right there again, the reason why a lot of the times when you have IV fluids you end up having to give a supplement with formula is because of that. And the truth is that that weight loss is not because your baby's not eating properly or you're not providing enough breast milk for your baby, but because of the weight loss of the water retention that they had to begin with after they were born. And the other things that I wanted to mention is alternatives. Make sure you educate and you talk to your health provider about alternatives that you had. I mentioned before, you can do the clear liquid diet. You can also do what they call a heparin lock, which is basically a catheter that you have attached to you but without the drip. In the case that there was an emergency, it's already there, so it's going to be a lot quicker. And the other thing is to make sure that you are eating and drinking fluids, like I said, in a small amount, but little and often and very light, and then you'll have all the energy levels that you need. You won't have to have the IV fluids. The only real reason that you would have to have the IV fluids is, like I mentioned before, if you are already planning on having an epidural, if you are at risk of having an emergency C-section or complications in your birth. But if you want to have just a normal and safe and natural birth, there's absolutely no reason why you have to have a IV fluid. So definitely discuss this with your healthcare provider, with your OBGYN, and with your hospital, because I had a really fast delivery with my third baby. It was basically from the moment I got to the hospital to the moment that I had her, it was basically 2 hours. It was super quick, and I had a natural birth, so there was no complication. There was no need for the IV fluid, and my baby was born perfectly healthy, was able to latch on right away. She was much more alert as well. I think sometimes the IV fluids tend to make your babies kind of drowsy or a little bit too sleepy, so that again causes complications with the latching and with establishing breastfeeding from birth. So definitely educate yourself. If you have any stories, please share them with us. Let us know if you have the experience of laboring without IV fluids and what that was like compared to maybe having IV fluids. I already shared a little bit about my story, and it's definitely something that I recommend that you educate yourself on. Bye, mommies. Besitos.
Thank you for watching this video. If you liked it, make sure you give us a thumbs up and you share it with another mommy that can find it useful. Also, hit subscribe. That way you'll get to see all our latest amazing videos that we're doing. I've also included below in the description of this video all our links for our social media so that you can follow us and be part of our community, our discounts, our giveaways. Awesome, mommies. Bye.